Good afternoon, everybody. This is Jim Goldman from Goldman Chiropractic and Acupuncture in Naples, Florida. Today we're going to be discussing the Psoas for mybesthealthmove.com. Whole books have been written about the Psoas, and when it's out of balance, it can really wreak havoc with your patient's low back. So typically I will check the Psoas after I have balanced the pelvis. First, I muscle test the Psoas to see if it needs any help. If it does need any help, it's going to be very apparent to both the patient and to me. So to test the Psoas, I have the patient hold the leg straight up. Then I ask them if that causes any pain. If it doesn't, then I ask them to rotate the leg straight out. And then I ask them to hold while I apply downward pressure. So hold strong. So if it's in good shape, it'll withstand a good amount of pressure. If it is not in good shape, it will drop down something like this. Maybe a little less dramatic, but it'll still drop down. A lot of times what I find too is if this Psoas, this side of the Psoas is doing okay, when I do muscle test it, because the opposite side has to stabilize when I push down, the opposite side will be a little bit sore. Now, a lot of patients haven't had the Psoas worked on before, and before I gouge them in the abdomen, I like to have them know where I'm about to go. So, I will point out to them, let me pull out my fancy iPad here. So, I will pull out my app right here, and we'll pull it up like so. I will show them the abdomen, and I'll show them that the stomach muscles are right here, and how deep it is by removing layers here, and they get a good idea of where we're about to go here. So we continue, and last layer, and there is the Psoas right here. Right here. There it is. So you can see the Psoas hooks up L1, 2, 3, 4, 5 disc into the lesser trochanter. You can see why it's crucial with the low back to make sure that that's balanced. If one side's spasmed and the other isn't, it acts like a crazy Venetian blind on that low back. So I show them that it's impossible to get to it from the back because there are too many thick muscles in the way, and that's why we've got to go in through here. Great app. All right, so first position the patient face up. Have them bring both knees up on the table. Now, the Psoas runs from L1, 2, 3, 4, 5 into the lesser trochanter right here. So this is about where you're working. In between the umbilicus and the iliac crest is a good place to start. Make sure your nails are clipped so that you don't Edward Scissorhands the patient. Ask them to take a deep breath in and deep breath out, and let me sink in, and just let your fingers get past the first couple layers of the muscle. Now, next we're going to find the muscle. And the way we're going to do that is we are going to engage it. So I place my elbow right on the knee and ask the patient to gently raise your knee into my elbow. And as you can see by her face, if you can see her face, it becomes readily apparent when you are on it. You'll also feel it spring up into your fingers. So one more time, lift, and there is that Psoas. Once again, note the face. So as you hold a little pressure, here's the Psoas right here, and it covers 5 vertebrae, so you'll be able to find what is more tender. So next we're going to speed up the process, and we are going to have them actively release this muscle. So if you would, slowly drag your heel down the table. Now, ask them, and you'll get a feel for it, but ask them to keep the pain level from your pressure at about a 5 out of 10. We don't need to make this totally miserable. We've already got our hands in their abdomen. Slowly drag your heel back up, and they're going to feel that underneath your fingers. So after going through this 2, maybe 3 times, we can follow up by retesting the muscle to see if we got the job done. So drop this leg down, hold this leg up, turn it out. Now, before when we tested it, it did this, and down it went. Next, if we've corrected it, hold strong, it'll be nice and solid. And the nice thing about doing the muscle test like this is if we've done a good job, they're going to feel a huge difference. So this is how I correct the psoas. It is overlooked a lot, but it will make a tremendous difference for your patients if it is a problem. Feel free to throw this into your bag of tricks, and thank you very much.